I got you.
Bonjour tout le monde. Good afternoon, everybody. We gather here on the Red River Valley, Treaty 1 territory and homeland of the Red River Métis. Thank you to everyone for being here today for this transformative announcement for healthcare for Manitobans. Merci d'être ici pour cette annonce qui va être extrêmement importante pour les soins de santé ici au Manitoba. And thank you to our amazing hosts here at the Red River College Nursing School. Manitobans justifiably have a high expectations of our healthcare system. We believe that no matter where you live, no matter how much money you make, that should not have an effect on the quality of care you receive. But lately, the system hasn't been meeting all those expectations. We've all personally had or know someone who has had an extremely bad experience with the healthcare system here in Manitoba. And oftentimes, those experiences are even more frustrating if you live in rural areas, northern areas, or in an Indigenous community. And that is why we are here today. Les investissements transformateurs que notre gouvernement réalise dans le système de santé ici au Manitoba feront une vraie différence dans la qualité des soins qui reçoivent les Manitobains à travers la province. We're making sure that our seniors receive the care they deserve because everyone should be able to age with dignity and on their own terms. For the details of this historic and transformative deal, I now turn to Prime Minister Justin Trudeau.
Merci Dan pour l'introduction. Je suis très heureux d'être ici aujourd'hui avec le ministre Holland qui nous aide à améliorer les soins de santé et les députés du Manitoba, Terry Duguid, Ben Carr, Kevin Lamoureux. Premier Kinew, Wab, it is so great to be here together today for this announcement. This is a big day. It's been a long time coming, and you've been an outstanding partner from the very beginning. So I really appreciate it. It's great to have your Deputy Premier and Minister of Health, Seniors and Long-Term Care, Uzoma Asagwara. Thank you very much for being here as well. Fred, other ministers and MLAs, thank you. Fred, thank you for welcoming us here to the Red River College Polytechnic Nursing School. It's appropriate that we be here today. It was great to sit down with some students earlier because healthcare starts with people, with the workers who dedicate themselves to taking care of others, make sure they get the training, skills, and support they need to give patients the very best care. J'ai eu la chance de rencontrer des gens qui étudient en sciences de la santé un peu plus tôt, des gens qui sont ambitieux et inspirants. Ces étudiants-là représentent l'avenir de notre système de santé. Et aujourd'hui, on est justement ici pour parler de ça, l'avenir des soins de santé au Manitoba. Every year, thousands of people put up their hands to become healthcare workers in Canada, like these students here at RRC. They join the hundreds of thousands of professionals who uphold one of the key promises linked to being Canadian, that no matter where you live, what you earn, you will always have access to high-quality, publicly funded health care. But we have to be honest with ourselves. Even as we take pride in our system, there are some real challenges facing our health systems right now. It can be too hard to access a family doctor or a nurse practitioner. Emergency rooms are too often overwhelmed. People are waiting for the surgeries they need, and healthcare workers are under immense pressure, working in conditions that make it even harder to be there for their patients. You've felt these challenges extremely acutely here in Manitoba. The pandemic was devastating here, but years of conservative cuts left Manitoba's healthcare system struggling to protect and care for patients. And of course, healthcare workers were pushed to their very limits. I remember having a Zoom call back in the spring of 2021 with the nurses at Victoria Hospital when things were pretty tough and they were dealing with one of the worst outbreaks in the province. They were there for people. We need to make sure they work in a system that can deliver the best possible care. One of the things that we've learned through the pandemic, through difficult times, is conditions of work dictate conditions of care. And the people who step up to be healthcare workers do so because they believe deeply in serving their communities and serving and in helping their fellow citizens. And when they can't, when the circumstances of their job or the pressures that are on them or the resources they have access to are interfering with their ability to give of their very best to their patients, that's when they get most frustrated. That's when they need most our support. The people of Manitoba deserve a system that is there for them, that they can rely on. That's what every Canadian deserves. And that's why last year our government stepped up. We've committed $200 billion over the next decade to strengthen public health care in Canada. As part of this investment, we said we'd work on tailored agreements with each province and territory to help address their unique challenges and needs. And today we're announcing that we've reached our 7th agreement, this one with the great province of Manitoba.
Hear, hear.
L'an dernier, on s'est engagé à investir 200 milliards de dollars au cours de la prochaine décennie pour renforcer les soins de santé publique au Canada et on travaille avec chaque province pour répondre à leurs besoins uniques. Aujourd'hui, on a une annonce majeure pour améliorer le système de santé des Manitobains. Our government will invest $434 million over the next 3 years to help Manitoba. It will increase the number of doctors in the province and recruit healthcare workers for rural and northern communities. It'll make it easier for healthcare professionals to practice in Manitoba, including those with foreign credentials. We'll see reduced wait times at ERs, and we'll address blockages and backlogs. We'll ensure people have access to the mental health care they need, including young people. We'll modernize the healthcare system, and we'll be addressing gaps in care experienced all too often by Indigenous peoples. In addition, we're making real investments to improve the lives of seniors in Manitoba, almost $200 million on top of the previous 434, which will mean more home and community care and better quality long-term care, including more personalized care for people who live in long-term care. En résumé, on a 2 accords avec le Manitoba aujourd'hui. C'est un total de 633 millions de dollars pour améliorer les soins de santé, y compris des investissements dans les soins à domicile, les soins communautaires et les soins de longue durée pour les aînés. On a bien hâte de poursuivre notre travail ensemble pour transformer les soins et pour livrer des résultats concrets. These investments are about delivering real results, about improving patient care and patient outcomes, including for the most vulnerable. Nothing is more important than your health. The federal government is therefore stepping up to make sure that provinces and territories are equipped to deliver the care you expect and deserve, and to protect the promise of our universally publicly funded healthcare system that is core to who we are as Canadians. La pandémie nous a montré toute l'importance d'investir dans les soins de santé et elle nous a rappelé à quel point les travailleurs de la santé sont essentiels. So I want to wrap up by thanking all the healthcare students here who've put up their hand to do this work. Wab and I just had a great conversation with a number of young people who talked about the calling, the drive they felt to get into healthcare and contribute to their communities, their desire in many cases to be able to take what they're learning here and return to their communities to deliver healthcare to the families and neighbors that they grew up with. But also we talked a lot about the mental health pressures on our frontline healthcare workers and how governments of all stripes need to do a better job of supporting them, and not just supporting them when they're facing their most acute challenges, but supporting them in a proactive way so people can stay resilient and healthy longer, even in the critically important and sometimes very, very emotionally difficult jobs that they are doing. So I want to thank every doctor, social worker, paramedic, orderly, therapist, OT, the list goes on and on and on, of professionals who step up to serve their communities, to serve their fellow Canadians. You are there for us, and today we're here to tell you that we will be there for you. You keep us healthy, you keep Canada strong, you continue to make Canada the very best country in the world, and we're going to keep working hard to make sure it becomes even better. With that, I'm very pleased to pass it over to my friend and yours, Wab Kinew. Premier.
It's time for us to take better care of the people who take care of us. And that's what this partnership with the federal government is all about. It's about investing in the people who are on the front lines of our healthcare system each and every day. So I want to thank the Prime Minister and the federal government for standing with us here today. On behalf of our team, Minister Asagwara, Minister Smith, MLAs Dela Cruz and Chen, I have to say I am really, really happy about this announcement. I'm happy because healthcare is our government's top priority. And to have the federal government commit that we are going to walk on this path to ensure that there's more doctors and more nurses for you is good news for the province of Manitoba. Having more nurses, more allied health professionals, more physicians in the province means that we're going to be able to reduce wait times. It means that the crisis we see today after years of PC closures in the emergency rooms is going to start to turn a corner. One of the lessons that we learned in tragic detail during the pandemic is that we have to do right by our seniors here in Manitoba and across Canada. And that's why the fact that half of today's good news is about making a commitment to seniors, specifically those folks who live in long-term care and personal care homes in Manitoba, is not just important, but I think it is fundamental to us being able to say that we are a society that treats the people who raised us with the dignity and respect that they deserve. And so this isn't just about increasing funding for healthcare. This is about increasing the amount of time each and every day that a senior has with direct care at the bedside. That is going to improve the lives of the people who taught us, who built this province into the great place that we know and love today. When we talk about ensuring that the folks that the Prime Minister and I just spoke with, allied health professionals in training, nurses in training, paramedics in training, we made the commitment that we're going to have their backs. And so today's announcement means that once they graduate and complete their programs, we're going to have jobs for them, good paying jobs right here in Manitoba, right across the province, so that they can put their valuable skills to work taking care of you. But I also want to be absolutely clear that universal, publicly accessible health care is a fundamental Canadian value. This is one of the things that makes us who we are as Canadians, who we are as Manitobans. And when we talk about making investments in healthcare, we're also talking about us articulating a message of who we are as a society, that we are a people as Manitobans and as Canadians that are not going to leave anyone behind, that we're going to ensure that you can access healthcare in the north, that you can access healthcare on reserve, that you can access healthcare here in the city of Winnipeg just as readily as you can in rural Manitoba. One of the fundamental beliefs that our administration has, and I know we share with our federal friends, is that we are one people. We are one province with one shared destiny. And the way that we live up to that promise, the way that we live up to that ideal, is by ensuring that any Manitoban can access the health care that they need when they need it. And so for us, we're very happy to be here and to extend a warm and hearty handshake to our friends at the federal level, because it means we can move on with our commitment, which we call our 4-3-2-1 plan. 400 more physicians, 300 more nurses in the city, 300 more nurses rurally, 200 more paramedics, and 100 more home care workers. That we'll be able to live up to that commitment to the people of Manitoba by working in concert with the federal government and the folks on the front lines of the healthcare system. So to close, I just want to say a simple message to young people across our province. We need you. We need you on the front lines of our healthcare system. And you are going to have governments at the provincial level and the federal level that are going to step up to support you if you step forward to take a career in healthcare. So to all the young people in Winnipeg and Brandon, in Thompson and in Cross Lake who dream of being a physician or a nurse, a paramedic or an ultrasound tech, I encourage you to pursue your vision. And when you take that step, our governments are going to meet you and ensure that not only is there good training, but also that there's a good paying job for you on the other side. So once again, I just want to say merci beaucoup au gouvernement fédéral. Ça, c'est une annonce merveilleuse pour la province du Manitoba. Nous embaucherons bien plus de médecins, d'infirmières, tout partout dans le Manitoba. Alors, je suis très, très content d'être ici aujourd'hui. Merci beaucoup. Miigwech. Thank you very much.
I'll now call up Mark Holland, the Federal Minister of Health.
Thank you so much, Prime Minister. Thank you, Premier Kinew. I want to thank Minister Asagwara. I'll come back to that in a second. Minister Smith, and of course, my colleague, Minister Vandal. And we, of course, also have Terry, Ben, and good friend Kevin. C'est un jour vraiment historique aujourd'hui. Et c'est un grand plaisir d'être ici parce que c'est un commencement d'un grand changement dans notre système de santé. Ici, certainement en Manitoba, mais dans le pays généralement. Look, we went through some really tough things, some really difficult times. The pandemic was a trauma felt to each and every one of us. But to our healthcare workers, and I look particularly at Darlene Jackson and Claire Becker, who are representing nurses who are with us today, or to Dr. Abu, who we had a chance all to talk about some of the challenges that exist here today. They held us up. And what was asked of doctors and nurses and healthcare workers, long-term care facilities and hospitals and all elements, was way too much to ask of any human being. But when you look at how we meet tough times, how we meet the challenges we have in this globe, what a guiding light that is to the transformation we need to do in our health system. Because what they did, all coming together, all having a single purpose, all asking, how can we help? How can we make things better? Is the spirit that I know infuses this agreement, and certainly the spirit that I see in the conversation that I've had with Minister Asagwara. Minister Asagwara and I had our first conversation very shortly after you were elected, and I can say that there's somebody who fundamentally gets it. Fundamentally gets it in terms of the size of challenge that's in front of us, but that you got to put up your hand and say, we're going to get it done. Understanding how hard it is, but that we have such incredible people across the country that we're so fortunate to represent, that count on their healthcare system, that count on that system being there for them, and know that we need to be there to make sure our healthcare system is already one of the best in the world, but it has to be the best in the world. And we've seen what happens when we face conservative cuts, when we face people who are more interested in playing down the system and pushing into despair and having people give up so that we don't fight for our public health care system. We know where that leads. Instead, what we're talking about here is making investments, making sure that everyone has access to a family health team that they can count on throughout the totality of their life journey. We know that when people don't have the care that they need, they're discouraged from going in early. They don't make that appointment. They don't catch that symptom. They end up getting a small illness that becomes something major. And that those investments are critical because it's not just about convenience of access or equity. It is also fundamentally about prevention and about making sure that we have a population that is healthy and therefore productive and therefore ready for the challenges that are ahead of us. I want to say that this agreement specifically is addressing those challenges. Today, two new agreements represent more than $633 million that will flow into the healthcare system here in Manitoba. The Working Together agreement that the Prime Minister was referencing is $434 million over the next 3 years. And the Prime Minister, in his comments, talked about some of those elements. I want to talk about them just a little bit deeper. It means that we're going to be hiring hundreds more doctors and expanded incentives to attract and retain healthcare workers. It means direct action to address surgical backlogs and reduce overcrowding in emergency rooms. It means recruiting more healthcare professionals to do work in northern and rural communities. In terms of mental health and substance use services, it means critical action to expand in an area where we're seeing crisis. And I have to say that with Minister Asagwara, the conversations that we had in the trilateral meetings, the solutions are there. We know what needs to be done, and this agreement is about going after that. Being able to visit places like 9 Circles and some of the incredible work that's being done on a community level. It also is ensuring that we can improve French health services, better access to high-quality, culturally appropriate health service for Indigenous people, including by the representation of Indigenous healthcare providers. The Aging with Dignity Agreement makes sure that our seniors are going to, after a lifetime of contributing to our society, able to live with dignity and vitality. This agreement sees $199 million over the next 5 years to increase the safety and wellness of our seniors by developing hearing aid programs and increasing services for victims of elder abuse. It allows more seniors to live independently, including by supporting home modification and expanded home care, so that seniors can age where they live. It means hiring more long-term care workers and support long-term safety and standards, and to ensure long-term care residents stay healthy and receive the quality care that they deserve. Aujourd'hui, nous signons des nouveaux accords qui permettront d'injecter plus de 633 millions de dollars dans le système de santé du Manitoba, qui vont embaucher certains des médecins et développer les mesures pour attirer et retenir des travailleurs de la santé, réduire la congestion dans les salles d'urgence, améliorer les services de santé en français, permettre aux personnes âgées de continuer de vivre chez eux, élargir les services de soins de santé mentale, améliorer la qualité de soins de longue durée, et beaucoup des autres choses. Ensemble, c'est une étape essentielle pour notre système de santé. And I just want to say that, you know, as the Prime Minister and Premier Kinew are talking to the students and instructors here, and, you know, the Prime Minister has always got so much passion for our healthcare system. And you see in the folks here, their passion and their expectation that we're going to do everything that we can to fight on their behalf to create the healthcare system that they deserve. That's what today's about. I was just saying to Uzoma before we began, this is the starting line, and I can't wait to continue working with you and Premier Kinew, your entire government. Thank you so much. Merci beaucoup. And with that, folks, I am very pleased to introduce Minister Asagwara. Minister? Thanks so much.
Good afternoon, everyone. I am very, very happy to be here for this announcement today. Thank Prime Minister Trudeau, obviously our colleagues, Premier Kinew, everyone who was able to be here for this announcement and who has contributed to us getting to this point. It is a big day in Manitoba. I'm honored to be able to be a part of us taking another step, another important step to fulfill our province to Manitobans to make healthcare better for them. That means more nurses, it means more doctors, it means more allied healthcare professionals, it means supporting more healthcare students, and it means more beds. It means better care for Manitobans. I want to acknowledge and thank the hard work of our entire team who made today possible, and certainly Minister Holland. The conversations that we've had since our government was elected have been very productive and very positive, and getting here today is largely in part of the work of so many people. You know, the work and the progress that we've made in our short time in government so far is thanks to the tireless, dedicated folks on the front lines of our healthcare system. Nurses, doctors, allied healthcare professionals, support staff, and yes, nursing students who we've met today, tech students who we've had the conversations that were wonderful with today. These are people who have dedicated their lives to serving Manitobans. This announcement today is really a message to those folks that our government has their back. Together, we will bring more staff directly to the bedside. We will raise the standard of care across the province for seniors and all Manitobans. And we will reduce wait times to make sure that everyone gets the care that they need when they need it. My job as Health Minister is to make this progress happen as soon as possible, as quickly as possible, by working together with our partners throughout the system. I want to make sure that every single person gets the care that they need for their mental health as well. If you're a Manitoban who needs access to mental health care services, you should get that in our province. That every senior is getting the care that they deserve at the bedside and in their communities. That every person who needs emergency care has an ER with a bed that's ready for them. Our government has a new vision, one where the culture of healthcare is the best in Canada, one where patients are at the heart of every decision that is made, and one where we work together with those on the front lines every single step of the way. That is the vision that we carry forward. That is the vision that we are taking a very important step toward today. Thank you.
Thank you, everyone. We will now start the question and answer period. Nous allons maintenant commencer avec la période des questions. One question, one follow-up. First question, please.
Hi. Cam McIntosh, CBC. For the Prime Minister, question and a follow-up, hoping you can respond in both English and French. So we've heard some critical comments made by the Parliamentary Secretary to the Foreign Affairs Minister regarding your government's policies and statements on the Gaza war. Your reaction to those comments, please, and can he stay on as a Parliamentary Secretary?
Well, one of the things that I've talked about an awful lot over the past number of months is how difficult it's been for millions of Canadians in having very, very challenging conversations with neighbors, with friends. There are people from different perspectives and different places that are hurting deeply, that are watching what's going on the other side of the world and having it impact them in their daily lives right now. One of the strengths of the Liberal Party federally is that we have always had a strong number of people who feel and who reflect the diversity of perspectives and views across the country. We have a large number of Muslim MPs. We have a large number of Jewish MPs. And the kinds of conversations that go on within our party are not always easy, but they reflect that diversity of conversations happening across the country. And that's why in everything that we have said, in our position as a government and as a country, it's recognizing the ongoing humanitarian catastrophe and crisis that is affecting the people in Gaza. It's condemning the terrorist acts by Hamas, including the continued keeping of hostages who must be released. And it's conversations about how we get to a two-state solution with a peaceful, stable Israel living alongside a peaceful, stable Palestinian state. Now, right now, more than ever, it seems a long way away, but we need to continue to dedicate ourselves to that long-term, viable peace in the region. That's why this morning I spoke with President al-Sisi of Egypt. I've spoken with Minister Benny Gantz in the Israeli government. Yesterday I sat down with King Abdullah of Jordan. And we are continuing as a country to engage in the full complexities of this situation with a steadfast focus on bringing forward peace, stability, and standing up for the rights of people to live in peace and stability, both on the other side of the world, but also here in Canada, where communities are really feeling the impact of what's going on over there, right here in their neighborhoods. Une des forces du Parti libéral du Canada, ça a toujours été qu'on a à l'intérieur de notre parti le reflet des genres de conversations qui se passent à travers le monde et à travers notre pays. Des gens qui ont été impactés de façon personnelle, de façon profonde, de très différentes façons par ce qui est en train de se passer à l'autre côté du monde. Et donc, en tant que gouvernement, on a continué d'être ancré dans les principes de créer de la paix, de la stabilité, de condamner l'attaque terroriste de Hamas et d'exiger la libération des otages, en même temps qu'on pousse vers une solution à deux États, avec un Israël sécure et stable à côté d'un État palestinien sécure et stable. Et c'est extrêmement difficile pour bien des gens, mais en tant que gouvernement, nous allons rester ancrés dans ces priorités-là. C'est pour ça d'ailleurs que j'ai eu des conversations juste ce matin avec le président de l'Égypte, avec le ministre Gantz du gouvernement de l'Israël, et hier une longue conversation avec mon ami Sa Majesté le roi de la Jordanie. Le Canada va continuer d'être là pour protéger les gens, pour appuyer le processus vers une solution stable pour la région, tout en luttant à tous les jours contre la haine et l'intolérance qu'on voit à travers notre pays avec une montée de l'islamophobie et de l'antisémisme en même temps.
Follow up on comments coming from the cabinet. The Environment Minister Guilbeault has commented that this government will no longer invest in roads. We have Northern First Nations that came out last week asking the province and the federal government to invest in an all-weather road system. It's the middle of February. Those roads have just opened. Climate change is a problem there. Will you invest in that?
The minister clarified his comments, that he was speaking about a very specific project in Quebec City. The reality is, since 2008, this federal government has stepped up massively on investing in infrastructure right across the country. Here in Manitoba, where there's conversations about the need for new road infrastructure to replace, yes, the fact that ice roads are no longer as reliable or viable in a world impacted by climate change, whether it's talking about other infrastructure projects like, I know when I sit down with Wab later, we're going to talk about the North End wastewater plant. There's lots of things to do. The federal government's position on being there to invest in infrastructure that people need right across the country, whether that be roads or bridges or ports or community infrastructure or whatever, we will continue to be there in partnership. And it's a contrast, not just with the Conservative government that preceded us, but the Conservative Party in Ottawa right now that continues to stand against investments in infrastructure, against the kinds of investments that help communities, because all they're proposing is cutting the investments, including in infrastructure, that Canadians are relying on. We will continue to be there.
Next question.
Bon après-midi, Monsieur le Premier ministre. Je m'appelle Cédric Nouféré, journaliste à Radio-Canada. J'aimerais rester sur la scène internationale. Alors, que prévoyez-vous de faire si le gouvernement Netanyahou ignore votre plaidoyer et attaque Rafah?
Écoute, c'est une conversation qu'on est en train d'avoir à travers le monde entre différents chefs, y compris des pays qui sont amis du peuple israélien, de l'État d'Israël. Nous sommes très préoccupés, comme j'ai dit hier dans un communiqué signé par moi-même et les premiers ministres de l'Australie et de la Nouvelle-Zélande, avec cette idée qu'il y aurait une mobilisation militaire contre Rafah. Les gens à Rafah sont en grande partie là parce qu'ils ont été déjà déplacés de différentes parties de Gaza. Ils sentent qu'ils n'ont plus nulle part où aller. C'est pour ça qu'on a exprimé directement, y compris ce matin quand j'ai parlé au ministre Gantz de l'Israël, ma grande préoccupation avec cette idée d'une mobilisation militaire sur Rafah. En tant que monde, on va continuer d'être là pour exiger plus d'aide humanitaire aux citoyens de Gaza. On va être là pour continuer de pousser vers un cessez-le-feu durable. On doit absolument éviter que la violence continue dans le mois saint de Ramadan qui s'en vient dans quelques semaines. C'est une grande préoccupation que nous partageons et sur laquelle nous travaillons.
Votre position sur le conflit entre Israël et le Hamas suscite des réactions de la part de Pierre Poilievre. Il vous accuse de dire une chose et son contraire à la fois. Que répondez-vous à ces critiques?
Tout d'abord, on a vu malheureusement que le Parti conservateur et M. Poilievre sont toujours là pour chercher des avantages politiques, même quand on parle d'une catastrophe humanitaire. Ils sont toujours en train de chercher un avantage quelconque. La réalité, c'est qu'en tant que gouvernement responsable, nous avons une position responsable qui reconnaît l'attaque terroriste qu'il y a eu par Hamas le 7 octobre, qui reconnaît le droit de l'Israël de se défendre à l'intérieur du droit international, mais qui reconnaît aussi que ça ne peut pas être les Palestiniens qui payent le prix pour la justice contre Hamas. Nous avons besoin d'être là avec de l'aide humanitaire pour les Palestiniens. Nous avons besoin d'être là pour assurer la libération des otages. Hamas ne peut pas avoir un rôle à jouer dans la gouvernance future de Gaza. Hamas doit arrêter la violence et arrêter d'utiliser des civils palestiniens comme boucliers humains. On est très, très clair que la seule solution à moyen et à long terme pour la stabilité et la paix dans la région, c'est une solution à deux États, avec un État juif d'Israël sécure et prospère et un État palestinien sécure et prospère et reconnu par la communauté internationale, avec des structures, des institutions qui vont durer le coup et servir les Palestiniens. Notre position est très claire et l'est depuis le tout début.
Next question.
Chris Kitching from the Winnipeg Free Press. My first question is actually for the Premier. It's in regards to the tragic deaths of a mother, her 3 children, and her niece in a case of intimate partner violence in Carman earlier this week. The mother of the 17-year-old victim has said that she raised her fears and concerns with child welfare authorities about her daughter's placement in that home and about the suspect, but nobody listened. Separate from the children's advocates' review, what kind of action will the province take, be it an investigation, an inquiry into the handling of the mother's complaints, any response to them, and any potential failures to protect not only her daughter but the other occupants of that household?
It's a dark time in Manitoba right now. I think anybody who's heard the news this week stopped in their tracks when they heard about a 2.5-month-old baby, 4-year-old, 6-year-old, 17-year-old, and the mother. And my heart continues to go out to this family and to the first responders. I can only imagine what the volunteer firefighters and the paramedics and the law enforcement officers on the scene from the RCMP dealt with in the past few days. And we're going to be there to support those folks. We cannot comment on specific cases regarding the Child and Family Services system in Manitoba because of the CFS Act. It's a responsibility that we have as government. But we also have a responsibility as government when terrible things like this happen in our province to ask the question, what went wrong? And more importantly, how are we going to fix it? How are we going to protect children, protect women, protect young people, protect vulnerable people in the future in Manitoba? I'm open to hearing the questions around a potential inquiry. An inquest would be up to the Chief Medical Examiner to call. But I can tell you right away, the internal work of asking these questions, pursuing accountability, and with an eye towards the future of guaranteeing safety for people in Manitoba, young people, vulnerable people, that work is underway.
As a follow-up, I'd like to get your thoughts and maybe the Prime Minister's thoughts as well. Specifically, what more will or can your governments do to provide appropriate supports to protect women and children and prevent intimate partner violence?
Our team is investing in prevention. We know that there are a number of resources that have been identified by the community as being needed to keep people safe in some of these very tragic and difficult circumstances. We're also committed to working with the community organizations who are already leading many of these efforts. So that work is going to continue. At the same time, I think we all recognize that the status quo when it comes to child welfare in Manitoba cannot stand. And so our government has made the commitment that when Indigenous nations step forward to exercise their rights as articulated through C-92, that we are going to be there to work with them quickly, compassionately, and with an eye towards ensuring that the safety of children in both the physical but also the cultural and social senses of the word are going to be guaranteed.
Yeah, this was an extraordinarily heartbreaking tragedy, and our hearts go out to all the members of the community, the first responders, and everyone who was impacted by this. As a government, we've put forward a gender-based violence strategy. We've put forward significant partnerships and measures to combat intimate partner violence and provide supports, whether it's mental health supports, addiction supports, to the range of contributing factors that exist so often in intimate partner violence. We've also moved forward on a number of initiatives, including red flag laws when it comes to gun control and gun permits, to try and keep guns out of the hands of people who have been committed or charged with intimate partner violence. We've also moved forward, as the Premier talked about, with C-92, which is all about making sure that kids at risk in Indigenous communities get to be supported in those communities in ways that are safe, yes, but also culturally sensitive, in language, and much more likely to give greater outcomes for them in the future. There are many, many factors that play into this, but I really have to say how pleased I am to be able to work directly with Premier Kinew on this issue that hits Manitobans particularly hard. But we've seen far too many tragedies right across the country over the past years that we will continue to work together to prevent in the future.
Brittany Hobson, the Canadian Press, for both the Premier and the Prime Minister. The families of Morgan Harris and Mercedes Myron, as well as the Assembly of Manitoba Chiefs, submitted a planning report to both governments last month about the search of the Prairie Green landfill. In that report, it laid out timelines that said excavation could begin in October if the funding was in place by February 1st. We've obviously passed that date. Given that this hasn't happened, are your governments confident that a search could begin this year?
Yeah, we are. And I think that we always have to begin by expressing our compassion and thoughts for these families. These are families whose loved ones are victims of what's alleged to be one of the worst crimes in our province's history, which is something that none of us want to imagine, but all of us are compelled to extend compassion towards. We are going to search the landfill at Prairie Green. We are going to work with the families along the way and Indigenous leadership, in this case, namely the Assembly of Manitoba Chiefs. We're also going to be there to support the families through what I expect will be a difficult next few months. And this work will continue. I think that we have a responsibility to ensure that our communication happens first and foremost with families and with Indigenous leadership prior to the public. But I would say to the public, given the strong interest in this from Manitobans and Canadians, is that at the conclusion of this process, when you look back at the timeline, our public comments to date will all have been accurate and consistent with where we're going to land.
Thank you. In 2015, when we got elected, it was partially because Canadians demanded that governments take reconciliation seriously, that we repair, or at least begin the work of repairing the broken relationship between governments, but also the trust that Indigenous people have towards the rest of Canada. We've done an awful lot. There is much, much more to do. I've met with the families of the murdered women, and I have continued to commit that the federal government will be there as a partner to make sure that they get healing and closure and that see justice is done. That means that the federal government will be there as a partner, as I promised to the Premier when he first got elected last year. The federal government will be there as a partner, but we recognize the leadership and the thoughtfulness with which Wab and his government are taking this extraordinarily difficult issue, and we will be there to do our part as well, because all Canadians expect it.
Follow-up question for the Premier. The report raises concerns about toxic material in the landfill and the various environmental approvals, and the family has been outspoken about the province's part in speeding up those approvals that would be needed. Has the province committed to approving the way these toxic materials and other material will be handled?
As we work through all of the complexities of this challenge, I think that there's a number of ways that we ought to support the families, and ensuring that there is justice in this instance, I think, is something that has to be top of mind for all of us when we're talking about this terrible, terrible situation. So we're working ahead with compassion. We're working ahead with the families and the Indigenous leadership in mind, and we expect that we will be able to fulfill our commitment to them and to the people of Manitoba.
Last question. Dernière question.
Question for the Prime Minister. So Donald Trump has made it clear he's willing to walk away from NATO. That's raising concerns about what he'd do about NORAD. If the U.S. were to withdraw, that would severely hinder Canada's territorial sovereignty. How concerned are you about that risk?
Canada and the United States are the only two countries in the world in which territorial defense is actually shared between our two countries. It's a testament to the deep friendship and interconnectedness of Canada and the United States for decades now. We have worked together in NORAD to keep North America safe, and quite frankly, Canada has recently stepped up with tens of billions of dollars of investment committed to modernizing NORAD to better suit the challenges the world is facing right now. I was down in Colorado Springs at NORAD headquarters just a few years ago, seeing the extent to which the Canadian and American military are not just integrated, but sharing command in the extraordinarily important element of territorial defense. We are always going to be there to work with our American partners on protecting North America, and I am confident that that is something that is very much in the interest of all Americans as well.
Just to follow up to that, the NATO Secretary General said that these comments by Trump on NATO undermines the security of the alliance and puts allied troops at risk. Do you agree with that assessment?
Obviously, the American people have a really important choice to make in the upcoming election in November. The world is more complex, more challenging, and impacting people's daily lives in ways that were hard to imagine even just a decade ago. The conversations that the American people have in the lead up to that election are going to be extremely important, and Canada will, as is consistent, stand up for our interests and our values, but allow the democratic process to unfold fully in the United States without our interference. Le Canada et les États-Unis travaillent ensemble depuis plusieurs décennies pour la défense territoriale de l'Amérique du Nord. Le Canada, d'ailleurs, vient d'annoncer des milliards de dollars, des dizaines de milliards de dollars en modernisation de NORAD, parce qu'on sait que c'est important de rester présent avec toutes les nouvelles difficultés auxquelles l'ordre mondial est en train de faire face. Je sais que les Américains apprécient profondément ce partenariat et cette amitié avec le Canada. Nous allons continuer d'être là pour se protéger les uns les autres. Par rapport aux élections américaines, évidemment, on va toujours être là pour défendre nos intérêts, mais on laisse aux Américains le choix important qui arrivera ce novembre.
Ceci conclut la conférence de presse. Merci beaucoup.